Managing risk is inherent in everything we do, both in our Navy mission environment and in our personal lives. Each of us learns from observing our environment, identifying the impacts that environment has on our activities, making decisions about how we want to respond, and then observing the results of our actions. We instinctively use our best judgment to assess the costs and benefits of each situation to make a decision. As we develop experience across more and more situations, we learn to manage the risks and consequences associated with them and eventually become adept at changing our decisions based on new variables. Operational Risk Management, or ORM, provides a systematic approach to risk-benefit analysis that helps manage complex situations, allowing decision makers to carefully think and evaluate a situation before taking action. ORM is a simple 6-step process which identifies operational hazards and takes reasonable measures to reduce risk to personnel, equipment, and the mission. This type of formal approach is especially important when faced with new situations. The COVID-19 pandemic is a challenging new situation that is likely to continue affecting our personal and professional lives for the foreseeable future. We are forced to live, work, and make decisions in a stressful environment with little recent precedent and incomplete and changing information. Case numbers may rise and fall in the area we live, work, or travel. Travel restrictions, changes to face-to-face conference or training plans, and rules about social distancing are all examples of the changing risk environment COVID presents. Despite new challenges, we must continue to prioritize the health and safety of our workforce while still executing critical mission requirements for the fleet. ORM will help us identify the unique risks associated with the COVID pandemic, manage them through planned mitigations, and then make risk acceptance decisions based on the expected benefit. The DoD and the Navy have recognized that applying ORM provides an effective framework for reducing mishaps. OPNAV Instruction 3500.39 Delta, Operational Risk Management, provides guidance for applying ORM. ORM is founded on 4 principles. Accept no unnecessary risk. Unnecessary risk contributes no benefits to the accomplishment of the task or mission. In other words, if you don't need to do it, don't do it. Everything involves risk. The most logical choices for accomplishing an operation are those that meet all the requirements with the minimum acceptable risk. Accept risk when benefits outweigh the costs. All identified benefits should be compared against all identified costs. Even high-risk endeavors may be undertaken when there's clear knowledge that the sum of the benefits exceeds the sum of the costs. Balancing costs and benefits is a subjective process, and ultimately the balance may have to be arbitrarily determined by the appropriate decision maker. Integrate ORM into planning at all levels. Incorporating risk management principles early in the planning and execution stages of an operation saves time and costs and gives decision makers the greatest opportunity to apply ORM principles. Make risk decisions at the appropriate level. Anyone can make a risk decision. However, the appropriate decision maker is the person who can allocate the resources to reduce or eliminate the risk and implement controls. The decision maker must know how much risk is acceptable and when to elevate the decisions to a higher level. At times, it may seem the easiest to accept no risk, but accepting no risk has its own risks. For example, we could effectively eliminate the risk of COVID infection at the work center by closing the office entirely and staying home. But completely abandoning the mission puts the organization, the Navy, and potentially the entire country at risk. So there is a risk-benefit balance that must be achieved that keeps us healthy and employed while allowing the organization to accomplish the mission. Now let's look briefly at the 6 steps of ORM. Identify the hazards, assess the risks, make risk decisions, implement controls, supervise, and review. Step 1. Identify the hazard. A hazard is any condition with the potential to cause mission degradation, personal injury or death, or damage to or loss of equipment or property. Experience, common sense, and specific analytical tools can all help identify hazards. Decision makers and hands-on workers bring different perspectives and may weigh risks differently. For this reason, a group discussion is critical to Step 1 and helps facilitate buy-in throughout the ORM process. Step 2, assess the risk. Risk is defined as the probability and severity of accident or loss from exposure to the hazards identified in Step 1. Step 2 is an attempt to predict the probability and severity of negative events caused by the hazards, combining those two factors to assign a final risk assessment code, or RAC. A key concept of risk assessment is probability. When assessing the probability of a risk, we're trying to predict the likelihood that a hazard will occur. These are given a code from A to D, with A being most likely to occur. For example, the NAVAIR enterprise uses guidance from the Navy's Bureau of Medicine, the local county health officials, the CDC, and OSHA to help us assess the probability of COVID infections. The probability of COVID infections is high when personnel are directly exposed to the respiratory secretions of an infected individual. The probability of infections changes in proportion to the rate of community spread, the number of potentially infected people in a group, the length of time that personnel are exposed, and the distance maintained between people. When assessing the severity of a risk, we're trying to determine the impact of the outcomes, categorizing them from high to low severity using numbers 1 through 4. In the COVID-19 environment, many of the potential hazards and consequences might be hidden from you. Do you know which of your employees or coworkers might be at high risk because of an underlying medical condition? Do you have a child or a parent that might be at high risk? As a parent, friend, child, or significant other, you must take these possible consequences into your personal calculations. As an organization, we must take these issues into account as part of our severity assessment when balancing the health of the workforce against the mission. Step 3, analyze risk control measures. Next, the team would investigate specific strategies and tools that might mitigate or eliminate the risks identified in Step 2. All risks have 3 components: probability of occurrence, severity of the hazard, and the number and level of exposure of people and equipment to the risk. Effective control measures reduce or eliminate at least one of these. The level of exposure can affect both the probability and severity of a risk and may be a good starting point to apply mitigations. Exposing fewer people to a hazard often reduces its likelihood of having severe consequences. Risk control considerations must take into account the overall costs and benefits, and if necessary, provide alternative solutions. Step 4, make control decisions. Identify the appropriate decision maker. This is the individual at the appropriate level who can balance the risk against the potential benefit and value to determine if the risk is necessary. The decision maker will consider the importance of the mission, potential impacts of the risks, the effectiveness and costs of the chosen controls, and ultimately whether or not the benefits outweigh the potential costs. Step 5, implement risk controls. Once the risk decision is made, a plan must be put in place to apply the controls that have been selected and provide resources, the time, materials, and personnel required to put those measures in place. Step 6, supervise and review. The final step of the ORM process is to monitor the situation and watch for change. Workers and managers should periodically reevaluate controls, monitor for new risks, and take action to correct ineffective risk controls. This step is critical to success. Without continual analysis of the effectiveness of controls, the next person in line may pay the price. With COVID-19, Step 1 is identifying the hazards to the NAVAIR enterprise and to the personal health of civilian employees, contractors, military personnel, and their families. Step 2 is assessing the risks, the probability and severity of exposure to the COVID virus. Probability should first be assessed in an assumed pre-COVID environment, that is, with none of the known risk mitigation precautions in place. Those precautions will be part of a later step. Severity of the impacts to personal health may range drastically from no symptoms to severe respiratory damage to death. The consequences to mission may include closing a work center, product line, or other facility, which in turn may impact the delivery of a product to the fleet or other customer. Now at Step 3, we consider the mitigations we set aside in Step 2. The risk of COVID-19 infection increases with exposure. The best way to protect ourselves and others and reduce the spread of the virus is to limit interactions with other people as much as possible. We should consider mitigations such as social distancing, wearing a face mask in public, and washing our hands. At Steps 4 and 5, we would determine and implement these controls, then continually assess their effectiveness. Contact tracing is one way to assess effectiveness of mitigation measures by investigating the actions of newly infected personnel and attempting to find the weak link in the controls. With much of the country opening up, personal and work travel is on the rise. There is no way to ensure you have zero risk of infection while traveling, so it's important to use ORM to identify the hazards, assess the risks, and try to implement as many controls as possible. Employees who plan to travel beyond the command's local commuting area for official travel or personal leave should review their plans with their supervisors before departing. Together, the employee and supervisor should assess the travel plans, weigh the risks and the benefits to determine an acceptable level of risk. When returning to work, the employee should contact the supervisor to provide details of stops and social distancing practices employed during the travel. Each situation is unique, but it's up to the supervisor to determine if and when the employee can safely return to the work center. The travel location, mode of travel, and potential social interactions will determine the hazard probability. The member's age and pre-existing medical conditions may impact the severity. Their status as teleworking or coming to the office upon return also impact the risk scenario for the organization as a whole. Their value to the work center versus the criticality of their physical presence on this specific trip should also weigh strongly into a cost-benefit consideration. Let's look at the impacts that the supervisor and team member might need to assess. In our scenario, the employee must provide a classified briefing a few days after returning from a business trip. Assuming the employee remained asymptomatic on their return, the supervisor must still assess the hazards of a potentially infected but asymptomatic employee. What is the impact to the mission if that employee can't perform the brief? Are any of the personnel attending the brief in a high-risk group? What would the impact be if the employee tests positive and that classified workspace needs to be shut down? What would the impact be to the mission if the work group receiving the briefing all became sick? The supervisor needs to think ahead and consider all these potential costs and impacts prior to making the pre-travel risk decision. Once you formally evaluate the hazard and associated risks, you can make an informed decision. Do the benefits of the event outweigh the costs? In our specific scenario, does the employee really need to make this trip? If the employee is only needed for backup support, do they need to be present in person? If our employee really does need to physically make the trip, does the employee actually need to be in the office in the next 14 days? Could someone else do that classified briefing in the employee's place? The supervisor in our scenario needs to make cost-benefit decisions about the risks to the mission, as well as to consider what mitigations and controls could be applied to reduce the potential hazards or reduce the probability of infectious spread in the work group. Let's discuss what we mean by mitigations and controls. There is some level of risk in everything we do. A mitigation or control is a method by which we reduce risk by identifying the hazards and taking actions to reduce the potential severity or probability of occurrence associated with that risk. There are three main types of controls to mitigate the spread of COVID-19 in the workplace: engineering controls, administrative controls, and personal protective equipment. Examples of engineering controls are features of the physical workspace that we put in place to help reduce the spread of infection. For example, workspaces might be adjusted to add plexiglass or raise cubicle walls to create a physical barrier between employees. Desks might be moved to put a distance of 6 feet or more between employees. These types of controls help to physically reduce the potential for direct contact with potentially infectious respiratory droplets. Administrative controls reduce risk through policy. This is very important while operating during the COVID-19 pandemic. Health protection conditions, or HPCon, on installations are an example, as are travel restrictions. NAVAIR has issued specific COVID-19 policy, guidance, and training aimed at reducing the risk of infection in the workplace. Administrative controls include maximizing telework or other altered schedules that limit the number of individuals working in proximity to each other, as well as the mandate that all individuals at all NAVAIR commands and sites are required to wear face coverings that completely cover the mouth and nose when entering and moving through NAVAIR facilities. There may also be current or future administrative controls mandated from the NAVAIR commander or higher headquarters requiring a screening process to enter buildings on base. Personal protective equipment, or PPE, is specialized equipment designed to protect individuals performing certain functions within an organization. Due to limited availability, PPE is not intended to be widely distributed, nor is it necessary for all employees. The proper use of engineering and administrative controls should significantly reduce risk of COVID infection for the workforce. Supervision is a critical part of the continuous approach to ORM. After risks have been identified, the hazards and probabilities have been assessed, and controls and mitigations have been directed, supervisors must ensure that controls are communicated, applied, and are being effective. Supervisors and employees should communicate frequently about the effectiveness of controls and assess if adjustments need to be made. NAVAIR leaders will continue to monitor on-site regional and local conditions for resurgence of infections and adjust ineffective risk controls to mitigate the danger to our personnel. Government, civilian, contractors, and military personnel all need to continuously assess their own COVID exposure risk and work with their supervisors to determine if additional risk mitigations are needed to protect the work center from COVID outbreak among coworkers. Not only when returning from leave or travel, but also based on daily interaction with the community. For example, if you eat at a crowded restaurant, you assume a high risk of COVID infection compared to the much lower risk of infection when you are eating at home alone. Additionally, after travel, quarantine greatly reduces the risk of spreading COVID to coworkers. Face coverings are one of the most effective ways to stop infections when worn properly. In addition, social distancing of 6 feet or more and space optimization have proven to be some of the best strategies to reduce the risk of infection in and out of the workplace. Integrating ORM into planning at all levels and as early as possible provides the greatest opportunity to make well-informed risk decisions and implement effective risk controls. It's essential for the individual to consider the event in which they are engaged and select the appropriate controls to meet the hazards they identify. The health and safety of our workforce is our top priority. Operational risk management, ORM, helps us mitigate risks and make informed decisions critical to accomplishing the mission.